Hey, what's up? My health enthusiast, Dr. LeGrand here for another video. If you are new here, we talk about all different health tips, alternative treatment options for your health, as well as fasting videos. So if you're new here, consider subscribing. So let's dive in right into the video right after this intro. So in today's video, we are going to talk about bloating. It's a very common thing that does happen. I see a lot of people come in for bloating issues, and people just, especially if you're trying to lose weight, having that bloating sensation, it's not a great thing to have. And I'm going to talk about different things that I have done with different patients and their experience as far as getting rid of bloating. So the first patient I want to talk to you about is a patient that came in that had a lot of gas and bloating and had a lot of different digestive complaints, abdominal pain, and the doctors didn't know what was going on. They tried different medications, they tried different, diets, but, the only excuse that they were kind of giving him is that, maybe it's just because you're overweight. But, the person didn't really think that was really the issue, so they came and saw me, and what I found with this patient, sure, he was having a lot of gas, yes, and uncontrollable gas, in fact, even when he came in to see me, as well as just a lot of abdominal pain, cramping, gas and bloating, all these things that were just causing him a lot of issues for several years. So I ran some tests on him. Sure enough, found things such as, like I've talked about before, his stomach acidity was very alkaline, and in fact very extremely alkaline, and his ammonium and nitrate levels were extremely high, where I usually measure that to look at his macronutrient breakdown. So those were very heavily elevated, and this happens over time when your diet is not very good. He was eating pretty crappy, a lot of junk food, just kind of also eating a lot of candy, things like that that just weren't best for his diet over time, and eventually your digestive system, it just wasn't working like how he would like to see it, and he was just dealing with a lot of these different types of issues. For most people, reasons why we get bloated, there's a few things, and this is one example of what I see a lot of patients come in for, is they tend to have a really crappy diet that tends to push them a little bit where their urine pH levels, or at least their acidity levels in their stomach, is starting to turn to be more alkaline. It's very hard to break down those foods, and so when it gets throughout our digestive system, it starts to really irritate it and cause allergic reaction to make that bloating sensation that we usually get. But also another thing that can be happening is also not breaking down the macronutrients very properly, and our pancreas isn't producing the pancreatic enzymes, digestive enzymes, to help break down those foods as well. So what I recommended for this patient, what we added, was things such as bringing down his pH levels. And what we do typically with that, we first start with a supplement such as like hydrochloric acid, or HCl. It's an over-the-counter supplement that you can use. But along with that, start incorporating things such as like apple cider vinegar, kombucha, carbonated water, as well as lemon and lemon water. Those things are naturally acidifiers that you can consume on a daily basis. So we started incorporating that so you wouldn't have to always continue taking the HCl. And then, as well as support to bring down his nitrate and ammonium levels, we added pancreatic enzymes to have him consume. Usually I typically recommend taking the pancreatic enzymes usually after your meal, as well as incorporating things such as bitter herbs. Bitter herbs such as dandelion root, golden seal, can be very beneficial for stimulating the liver, as well as stimulating digestive enzymes in your digestive tract. Along with that, usually when somebody has for a prolonged time been in the state with gas and bloating and really abdominal pain, usually the digestive tract lining, your large and small intestines, have been irritated and they need some healing, they need some soothing. So some great things that you can start incorporating, I usually recommend this more in liquid-based form and not in pill form, is echinacea, gentian root, and milk thistle. Those three things can be really soothing for the digestive tract and can start healing the digestive tract as you start to incorporate something harsh like HCl, so it kind of still protects it as you're starting to incorporate that to change your stomach acidity. And just within a month's time, he was able to really alleviate a lot of the gas and bloating and abdominal pain, things that he's been looking for years of trying to solve with other doctors, but just wasn't able to find that. And sometimes it is the most simplest things. Also, he started changing his diet, eating more things, more vegetable based, things that were easier to consume. Usually people who are more have a sensitive digestive system, they need to have things that are more pre-digested. So even like your vegetables have more steam cooked or make it in a juice or a soup, as well as with meats, having it more pre-digested and maybe not such the high fatty types of meats, sticking with more, lighter meats such as chicken, turkey, and fish. So we started changing that. So that really helped improve there. Along with, starches, more of the root types of vegetables as using as their starches, or cooked corn, that's considered starch versus the, complex carbs. But yeah, just within a month's time, we were able to get his digestive system back on track and be able to feeling great again. Now, the other big culprit when it comes to that bloating sensation is food allergies. And I know I'm not going to go in here and saying, gluten or whatever, where it's become the big, huge thing where people think, they have a gluten allergy, which I would say is probably less of the case. A lot of times what I see is there might be a certain food culprit of a food allergy that could be an issue. And the way that you can do this without having to go in and do an expensive food allergy is start doing a food elimination diet. And what this is if you have a suspicion of some particular foods, you can eliminate those foods, whether it's milk or gluten, if you're suspecting that it could be the reason of your bloating sensation that you're getting from your stomach, and also even joint pain. To eliminate that for about a month or so, sometimes it takes even longer than a month to get that food out of your system completely, and then reintroduce one at a time to see if those symptoms come back. That's how you can kind of know without having to do an expensive food allergy test. But I do food allergy tests, do the scratch allergy test for both environmental and foods. So one patient I had that came in, this gal that came in, we did the same things. She had the same kind of issues, gas, bloating issues. In fact, she was a young gal, teenage gal, and couldn't even go to school because of how severe her abdominal pain, IBS, and bloating was going on. And she'd been to all different, different types of doctors, gastroenterologists, several different types of specialists to figure out what was going on. Couldn't really figure out anything. So again, it was going back to looking at more of the nutrient-based stuff, things that were out of balance. And we did make the adjustments, the things that she also had. Again, her acidity level was really more alkaline-based, so her stomach acid wasn't really where we wanted to see it. We made those fine adjustments. Also, she wasn't breaking down her macronutrients very well. But even after doing that, she had some improvement when we incorporated things as HCl, pancreatic enzymes. She had some improvement, but not to where I want to see it. I wanted to kind of see it eliminated. So we decided to run the allergy test. Usually I put that on the last because it's not always the case. A lot of times it can be simplified by just changing your diet and implementing certain supplements that can help break down your foods. So if you are somebody like that, trying to use something like HCl or pancreatic enzymes that can help improve that, or probiotics. Sometimes the gut flora can be imbalanced as well, especially if you've been on a series of antibiotics within the last 2 years. You want to be making sure that you're taking some probiotics to be able to return back the gut flora, the good gut flora, to be able to really start helping consuming the foods that we do eat on a daily basis. So we went ahead and we did the food allergy test. And what's interesting is that we might think that there might be certain culprits, but there's some of those outliers that we have no idea. And for her, it was corn, chocolate, which is really interesting. Chocolate was one for her, as well as milk. So those three things were really big on her category. And once we eliminated those things, her symptoms completely went away. And we would have not really known that, especially something like chocolate. She never ever thought she had issue with chocolate before, because she would have it, but sometimes it could be so subtle, and it's really hard to determine, especially if it's chocolate's in a lot of different things. You might think it's maybe the bread, you might have chocolate with bread or something like that. It's really hard to determine that unless you do a food allergy test or do the food elimination diet and just kind of work with it. Now that can be a lot of work for some people to be able to do that. But once we eliminated that, everything went great. So really when it comes to bloating, first thing is you got to look at your diet. Diet is very important when it comes to bloating because it might be that your body doesn't digest food very well. And so the other culprit could be as well as mixing too many different types of foods at one time. And what I mean by that is when you mix things such as like high sugars with proteins, it's not a very good combination for the digestive system, especially for people who have sensitive stomach. So trying to separate your fruits or your sugars away from your big main course meals, eat as more of a snack, is a great way of implementing that. The other thing is also having liquids with your main course meal. The reason I say this is especially for people who tend to not have very good stomach acid breakdown of their foods. They tend to run more alkaline. If you're consuming any kind of liquid or water during your main course meal, it's going to be watering that down. It makes it harder to digest those foods. So trying to keep your liquids at least 10 minutes away from your meals is a great thing to do to start implementing so that you can be having a good, breakdown of your foods, having a good bowel movement versus, having that culprit messing up basically the breakdown of the digestive juices in your system. Hope you guys like this video. If you guys have any further questions on gas, bloating, digestive complaints, go ahead and leave that in the comment section below. And then as always, if you are new here, go ahead and hit that subscribe button, hit the notification bell so you don't miss out on any other future videos, as well as you can check out some of these other playlists that I have here that you can check out. Till next time, I will see you in the next video. Thanks. Bye.